November 16th celebration in New York City at the New York Academy of Sciences was to recognize the 10th anniversary of the Johns Hopkins Malaria Research Institute. Right now, malaria is coming under control in some parts of the world and not others. The largest attention, of course, is sub-Saharan Africa, where the disease is most heavily endemic and the greatest loss of life. So the two areas that I find most exciting are based on the success that our Hopkins colleagues have achieved. First off, in the field studies in Zambia, Philip Tuma and his team, working in the past decade, have led to a 97 to 98% reduction in the prevalence of malaria. In the regional hospital in Macha, which used to have 1,000 to 2,000 children admitted per year, now has maybe 24 admitted with malaria. Instead of having 100 or more deaths, it may have 1 or 2 deaths. Still some deaths, but greatly improved. So I think in terms of a public health approach, to translate the messages learned in the Macha research activities and employ those in other parts of Zambia and into Zimbabwe will be of high priority, and we're at work right now with an International Center of Excellence grant from the National Institutes of Health for the next 6 years to be working in Zimbabwe and right up on the border of Congo to see if we could translate the same messages and with equivalent positive results. So I think that the public health practices are exciting, and the laboratory continues to be amazing, with perhaps our strongest laboratory presence being our vector biologists, our mosquito biologists. George Demopoulos presented a brilliant presentation in New York, and people came away, I could hear them muttering, "This guy's a rock star." I think if we could trick the mosquitoes to become resistant to the malaria infection, those mosquitoes will be preferentially selected in nature, and they will outbreed the malaria vulnerable group of mosquitoes, and that would be another block in the infection. It sounds like it's science fiction, but in the laboratory right now it looks like it's working.